treatment, and especially treatments for something like cancer, which can be very time sensitive. That's the harm that these illegal freezes by this administration have really put into play here. And I hope you will speak up loudly and clearly and push back at the President and Mr. Musk on these freezes. These were appropriated funds. Article 1 of the Constitution and the law says that the administration is supposed to be spending those funds in accordance with the grants and the clinical trial plans. President Trump has not only effectively frozen NIH funding for existing clinical trials, he's also stopped review of new grant applications to help develop new cures for diseases such as pediatric cancer. Your written testimony focuses heavily on questioning past NIH research, but you don't lay out a plan for supporting research by our talented scientists across the country to help treat devastating diseases. You've talked about this with some of my colleagues, but if confirmed, will you immediately restart all NIH academic review committees and get all appropriated money out the door?
If confirmed, absolutely, Senator. My job would be to make sure that those fundamental scientific meetings and other activities happen. The purpose of the NIH director is to support the mission of the NIH.
Okay, thank you. I'm going to forego the other questions I was going to ask and just say this. For people watching this hearing, for parents who are worried about autism in particular, let me just say a couple of things. We see more cases of autism in this country than we used to for a number of reasons, part of which is we're much better at diagnosing it earlier and understanding what the spectrum of it is. We have ongoing science that is beginning to point at the NIH, among other places, to genetic issues that may play a part in the development of autism and environmental issues. The now retracted study that suggested wrongly and fraudulently that autism might have a relationship to the MMR vaccine has been refuted by 7 studies, every continent, that involved hundreds of thousands of children. So for parents out there who may think that vaccines have something to do with autism, there is no scientific evidence that it does. And it disappoints me greatly that neither you nor the Secretary now of Health and Human Services are willing to say that declaratively and strongly, because what you do when you hesitate, what the Secretary does quite cynically in my view, when he hesitates about this, is you churn and sow doubt and worry at a time when we should be focused on actually finding the cure, the cause and the cure of autism. And similarly, when we talk about the causes of chronic disease in our kids, there is plenty of evidence, you've talked about it, working class folks in America have worse health than richer people. And yet you are about to join an administration that is dedicated to giving more tax cuts to billionaires and taking away things from families, money and services from families that could help them live healthier, better lives and have children less subjected to things like hunger and housing insecurity, which contribute to chronic illness. So I hope you will think about that. I am over my time, and I think Senator Tuberville is next.
Thank you. Thank you, Doctor, for being here. It's always good to run into somebody that's name's harder to say than mine and mispronounced more. You got a hard job in front of you, but I share the ideas and desire that the President has to root out waste and the fraud that we have in this country, because if we don't, we're not going to have a country left. It's going to be gone. And he's doing the right thing. You're going to have a tough job. You're going to have to put your team together and do the same thing. We have got to make sure we use American taxpayers' money the right way. So kind of give me your plan of how you're going to do this to when you come into office and are confirmed, how are you going to put your team together?
Senator, first I should say I have a background as an economist in addition to being a doctor. Senator, I should say I have a background as an economist as well as being a doctor. And to me, that background, what it leads me to do is understand that every dollar wasted on a frivolous study is a dollar not spent. Every dollar wasted on administrative costs that are not needed is a dollar not spent on research. The team I'm going to put together is going to be hyper-focused to make sure that the portfolio of grants that the NIH funds is devoted to the chronic disease problems of this country. It's going to be devoted to making sure we have not just incremental progress, but research projects that have the capacity to make huge advances in treatment for cancer, for diabetes, for obesity. That's how I'm going to decide what the team is. And the NIH is actually, I'm blessed in some ways because it already has so many excellent scientists there to advise me on the areas I don't know about. And I want to tap that resource. I want to make sure I talk to every single person who's already a leader at the NIH to understand where those opportunities are.
Yeah, well, thank you. You know, for the past 4 years, I've been on this committee, and we've obviously gone through COVID, devastating to not just our country, but the world. Transparency and trust is going to have to be earned again from a lot of people. Most people across this country don't know what the hell NIH stands for, okay? But now they do because of COVID. You said that science has to be reliable. Exactly. But people also have to trust. You know, we're finding out now we have biolabs in Ukraine where a war's going on, and we're funding them. I mean, and so you've got to be on top of that, and you've got to, the American people have to trust you that you will say, listen, we're going to keep an eye on, you know, the biolabs in North Carolina or wherever we have them, because it scares me to death of what's going on. What's your plan there of getting trust back in this country?
Senator, first of all, I want to make sure that, and I want to work with the Congress to make sure that there's appropriate regulation of any risky research. The NIH should have, I don't think should be doing any research that has the potential to cause a pandemic, and I want to work with Congress to make sure that happens. As far as trust, I think the key thing is we have to be utterly open. If I'm confirmed, I'll be the head of an organization that's a scientific organization. As a citizen, I would often look for FOIA responses from the NIH, Freedom of Information Act requests, and they'd be fully redacted during the pandemic. You can't have trust unless you are transparent. And if I'm confirmed as NIH director, I fully commit to making sure that the American people can see all of the activities of the NIH openly with limited sort of obfuscation, which is characterized, I think, unfortunately, the NIH's way that they interacted with the American people.
And I think that starts with being very visual on television, telling people, you know, the truth. Don't hide anything, because we've been hiding things for years, and that doesn't work. We found that out. You know, Chairman Cassidy and I led a letter to the NIH under the last administration asking questions about a grant that the NIH funded focused on children transitioning genders. The study followed all these children. 2 of them committed suicide. Devastating. So how can we ensure the NIH doesn't grant funds to things like this?
Well, first of all, I think it's if you have a negative result and it's politically inconvenient to you, you have an obligation as a scientist to report it, right? So the NIH funds a study that shows that the gender transition doesn't reduce suicide rate among adolescents. That researcher has an obligation to report it, even though she or may think it's politically inconvenient. So I want to make sure that NIH researchers are required to report even negative results. There's ways to do that we can talk about. But I think as far as like the prioritization of studies, as I was telling Senator Paul, I think we want to make sure that the studies are focused on the diseases that really are hurting Americans. Obesity, a lot of the research that it's so easy to come up with examples of. There was one of a shrimp on a treadmill, for instance, that was once funded. I don't. It's not that I'm necessarily against research like that, but the American taxpayer should be focused on the needs of American taxpayers, and the research should be focused on those needs, the health needs of Americans. And I want to make sure that the NIH, if confirmed, focuses on exactly that.
Thank you. Good luck.
Thank you so much.
Senator Hickenlooper.
Yes. I hit it and it turned itself off. Thank you for being here and for all your service. As we've already heard today, and you're already well aware of, this cap on the indirect fees for all NIH grants has been traumatic to the system. It's now on a pause. Clearly, the solution is some sort of more transparent, well thought out, fair system by which research in the center of the country, the South, the North, East, the West, is all in a level playing field. How long, let's assume that we get the legal stuff sorted out, the chaos comes down a little bit, how long would it take to create a new system like that?
Senator, I don't know that it would take a new system necessarily. I think the key thing is, as you said, Senator, the transparency, right? So audits of university spending of indirect costs would help, I think, help inform decisions. It's a complicated question. Of course, I wasn't involved in the decision about the cap, but if I'm confirmed as NIH director, that's something I'll look very carefully at. The broader problem is we have deep distrust by the American people of universities and the scientific establishment earned during the pandemic. To address that, transparency is the key way. Just as I was telling to Senator Tuberville, that transparency is what will solve this problem.
We agree on that. We've been working on a project called the Deandra Dixon Include Project Act. I think you know a little bit about it, but the idea is that we codify research activities at the NIH on co-occurring disorders of Down syndrome across multiple institutes of the NIH. And I'm not asking your endorsement, but I am asking if you'll be willing to work with us on this. We're very serious about it. And then also look at how more broadly on cross-institute work at the NIH to try and unlock new discoveries.
Senator, I'm absolutely committed to that, and I'd be delighted to work with you on that project that you just mentioned, as well as other projects. I think there's tremendous opportunities for cross-disciplinary work across the NIH. I think it's at the back of the minds of so many reform proposals at the NIH I've seen over the years to try to make sure that the NIH research doesn't stay siloed within one institute, but that it's useful for researchers all across the NIH.
Right. I want to spend a little bit of time thank you for that. I appreciate that. A moment just looking at, we've heard a lot of people suggest that somehow the NIH is allowing the United States to be taken advantage of in some ways. One fact that is striking to me that in a 10-year period, 99% of the drugs approved by the FDA were developed with research to a larger or lesser extent from NIH. Are you worried about the U.S. ability to maintain that leadership? Do you think we're being ripped off in some way? The fact that we are affluent enough and care about science enough that we are leading the world in this research, is in some way this unfair?
Senator, I think the United States is the greatest country on earth. And one of the reasons it is that it has a sincere commitment to doing fundamental research that benefits all of humanity. And I think much of the NIH research does exactly that. I don't view it as ripping off when a scientist comes up with an amazing idea that that treats, diabetes better. Everyone on earth benefits from that.
Right.
So I think NIH as fundamentally an institution aimed at the public good.
So here's a more difficult question, which I've caused just to be suggestive. Do you think we're spending enough on research in terms of where you're coming in? Part of your seat is going to say, are we running out of good ideas? Is there a shortage of things that really demand our attention?
I think that, as I outlined in my opening statement, I think there's some real problems in how the scientific establishment is operating. The replicability crisis, a lack of desire to focus on the diseases and the conditions that really are inflicting Americans, and also a sort of tentativeness to focus on the big ideas. No matter what the budget is, I want to reform it in that direction. I'm happy to work with Congress. It's Congress that decides the budgets of the NIH.
We decided based on a lot of your advice. So be thinking of that. Obviously, increased vaccine skepticism. We're seeing just in the past school year, the number of kindergarten kids that are exempted for one or more routine vaccinations has continued to rise, the highest levels recorded. Is this rising skepticism around vaccines, is that going to make vaccine-related research at NIH any less of a priority? And if confirmed, how you balance the need to focus on research into chronic diseases with that need to invest in research on viruses and things that a vaccine can address?
Yeah, Senator, I think the increasing skepticism, which I view as a hangover from the COVID pandemic, sort of overstatement about how the COVID vaccine worked, makes it more important to do vaccine research. Senator Secretary Kennedy has already said he favors the MMR vaccine. I agree with that. I think that research, maybe I'm naive, Senator, but I believe very fundamentally that research, if it's done right, it's replicable, is so persuasive that it'll move people to take actions. And that's the philosophy I've operated under my entire career. I intend to keep doing that if I'm confirmed.
From your lips to God's ear. Thank you.
Senator Moody.
Mr. Chairman, good to see you. As you know, I am the most junior member on this committee and recently transitioned from my role as AG in the state of Florida, the great free state of Florida, to US Senator. And one of the things I have enjoyed the most is these confirmation hearings, because so much of what I worked on in my prior roles, whether that was a judge or a federal prosecutor or the attorney general, have translated in my ability to be able to truly, in a meaningful way, talk to the nominees about their vision for these agencies or roles that they're taking over, and how they might bring a different perspective or leadership or ideas to bear. And I particularly enjoyed that in our discussion. I'm honored that I was the last meeting you had before your confirmation hearing today. As you know, in Florida, as we were experiencing COVID here in the United States, Florida took a very deliberate, scientific, very thorough approach to making decisions. And we tried to bring to bear many varying opinions as to not only what we were experiencing as to the virus, but what were the best ways to go about making decisions and providing leadership and protecting the health, safety, and welfare of our citizens. And to some extent, many of those decisions were challenged, or even the first of their kind in the nation, because we were truly examining all aspects of information coming in, not just what was being pushed through certain narratives. And in many respects, many ideas and thought and scientific approaches were suppressed. And I want to talk to you a little bit about that, because I know you have been such an advocate of how we led in Florida, the things we did. As you remember, when I was AG, we opened our schools right back up right away. We were sued by a teachers union. And everything from how we dealt with masks to social distancing to the vaccines, there were misrepresentations abound during this time. And so I want to talk to you about how your opinion on how Florida handled that and how you think that might translate into your new role. Do you feel like your views and scientific opinions might have been disregarded or set aside in pursuit of some government narrative that may not have been based, especially, I know, even as to the 6-foot rule, for example? My office led a grand jury investigation on all kinds of misrepresentations, from the 6-foot rule to the vaccines. And I just wanted to get your thoughts on that and how that might affect your role moving forward, if in fact you're confirmed.
Senator, thank you for that question. I am tremendously proud to have been involved in advising the Florida response to the pandemic. One of the things, I was actually involved in the case that resulted in the Florida kids being able to go back to school. So even as my kids were left out of school, basically not allowed to go back into the school buildings for a year and a half, the kids of Florida were allowed, and as a result, the results are so much better. Florida has a lower all-cause excess death rate during the pandemic than California did. So I think Florida's response to the pandemic was a tremendous success. But I'm really glad you highlighted the role of censorship and restriction of scientific discussion. It was so refreshing to me to be allowed to speak my scientific views in Florida during the pandemic. I think the root problem, a pandemic is a very difficult thing. There's so many people are going to have different ideas in an environment of uncertainty. The root problem was that people who had alternative ideas were suppressed. I personally was subject to censorship by the actions of the Biden administration during the pandemic. Science, to succeed, needs free speech. It needs an environment where there's tolerance for dissent. And the reason I think why Florida did so well was that it provided an outlet for that dissent, so that the government of Florida, the state of Florida, could adopt the best ideas for its. It's not that no mistakes were ever made. You can't say that of any state in a pandemic. But in order to do well, you have to allow people to speak with each other openly, even when the ideas are controversial.
And so much of what we discussed and what you want to bring to bear, I believe, is taking publications or studies and having those replicated and making replication of studies be a priority for NIH, because so often you have people publishing and there's not that. Can you elaborate?
Sure, Senator. There's a crisis of replication. So many studies are not replicable. You do a study, and then someone else tries to do the study, and people won't cooperate and give the data to you. So to try to do the replicate, and then other teams try to do it, and they can't replicate it. Many studies are published, and it's not subject to replication at all. But replication is the heart and soul of what truth is in science. If I write a study and you find the same answer as me, then I'm more likely to be right. I want to make the NIH committed to that kind of notion of truth rather than authority as the way of truth
I
is
set you up to go over time. I apologize.
So sorry,
Sorry,
Senator.
Mr.
Yeah.
Chairman.
Senator Kim.
Thank you, Chairman. Doctor, thanks for coming on out. You had said before that you were in favor of decentralizing in the decision-making at NIH. I think a quote, restructure the NIH to allow there to be many more centers of power, concern about individuals or small number of individuals from dominating decision-making. Do you still stand by that? And if so, what's the importance of decentralization from your...
Senator, I think I do stand by that, Senator. The key thing to me about decentralization is a diversity of ideas to address uncertainties, and when we have problems that we don't have the answer to, we have to allow there to be many people with different ideas to test them. Having a diversity of ideas, we talked already with some of the other senators about making sure scientists from smaller states get access to NIH support. That's one way to do it. Having younger scientists, or early career scientists.
But you're
with
also
different
saying
ideas
just decentralization in terms of who's making the actual decision, not where the resources are going. Is that correct?
Well, I mean, if I'm confirmed as NIH director, the job will be to decide how to set processes to making those allocations. I want to make sure that those processes allow early career investigators to have support. I want to make sure that it allows scientists from non-traditional universities, not just the Stanfords and Harvards, to have support. I want to make sure that the people with different points of view about scientific hypotheses, not just not just amyloid hypothesis, but other hypotheses, have some capacity for support.
So in terms of the decision-making process that we'll try to diversify that, I guess my question to you, if you're pushing for a decentralized decision-making process for the grants, does that mean that you would oppose the HHS secretary or the Trump White House from telling you to make decisions about where to spend money or funding grant decisions?
Senator, I agree with the goal to make America healthy, meaning address the chronic disease crisis. That's a decision about allocation to different disease areas. Mm-hmm. The scientific ideas inside those disease areas.
What if the HHS secretary said, I want you to fund this specific grant at this university?
There's a process, Senator, for deciding who gets grants, the specific grants, right? There's a scientific review panel.
But is that one of the processes? Is that something that you feel like is a valid way in which decisions can be made at the NIH?
Senator, I don't believe that either secretary or the president would ever ask me to do that.
Well, I guess the reason why I asked this is, you talked a lot about chronic diseases. I think all of us can agree we need to make chronic diseases. My question to you is, do you think that our work on researching chronic disease needs to come at the expense of research for infectious disease?
Senator, I think that the allocation of funds to the different disease areas, first, Congress has a tremendous important role in deciding that, and I'll work with Congress for sure to make that happen. But also,
but you think that we could probably do both, right? Both chronic disease research and infectious disease research?
Yes, Senator.
Okay. Well, the reason I mentioned this, and I asked these questions about the Secretary's ability to direct NIH, is that he had a quote that has just really stuck with me to alarm me. He said, quote, "I'm going to say to NIH scientists, God bless you all. Thank you for public service. We're going to give infectious disease a break for about 8 years." Now, does that sound like a good idea?
Senator, I've had many conversations with Secretary Kennedy, and he is supportive of excellent infectious disease research. The idea that
you believe he no longer stands by that quote?
Senator, I don't know where the provenance of that quote. Maybe it's on Twitter or something. But people say things on Twitter. But as far as
but he said it at a conference.
Yeah, I don't know about it. But my interactions with Secretary Kennedy, he's sincerely committed to making sure that every health need of this country is met, including infectious diseases.
In terms of a few other things, are there any vaccines out there that you are concerned about in terms of safety?
Senator, I was concerned about the COVID vaccines for young men with causing myocarditis in 2021.
And do you have a view on long COVID?
Senator, I think it's a problem that affects millions of Americans that we need answers.
Is this something worth NIH funding?
Yes.
You had a quote before that I was concerned about. You said, quote, there are more pressing health needs for the $1.1 billion that the NIH will spend on long COVID. Is that something you still stand by, that quote?
Senator, I think that the funds that have been spent to date on long COVID have not provided answers to the millions of patients. I think that they deserve answers. We need to do a better job with the funds we spend at the NIH so that it actually produces better diagnostics, better cures, better prevention.
On transparency, just real quick, you talked about the importance of transparency. Are you familiar with something called the Richardson waiver?
No, Senator.
Okay, well, I ask if you're confirmed that you look into this. The Secretary just reversed this, and it is something that closes some transparency and public comment periods. Thank you.
Thank you, Senator Kim. Senator Banks.
Thank you, Mr. Chairman. Doctor, congratulations again on your nomination. As I've said before, your nomination is one of the most exciting picks of the entire Trump administration. You showed incredible courage in speaking the truth about COVID-19 when much of the rest of the world stayed silent about it. And free-thinking people everywhere have not forgotten that, what you stood for then. And it's remarkable to see that you're nominated to be the head of the very institution whose leaders persecuted you because of what you believed during that period. I want to start by asking you about COVID. Lockdowns caused irreparable harm to our nation, and they are still harming us 5 years later. What is NIH's proper role in a pandemic, and how did Director Francis Collins overstep that role during his time?
Senator, the proper role of scientists in a pandemic is to answer basic questions that policymakers have about what the right policy should be. Our role isn't to make decisions to say you shouldn't be saying goodbye to your grandfather as he's dying in a hospital. It shouldn't be to say you can't have a funeral because it's too dangerous. The scientists should say, here's what the risks are. And then you decide what the risk, whether you take it. The role of the scientist shouldn't be to say you can't send your kids to school for 2 years. That you can't you should close hospitals so that they can't treat heart attack patients. That you should not the role of scientists should be to address those problems by giving good data and then let people make the science should be an engine for freedom. Knowledge and freedom, not something where it stands on top of society and says you must do this, this, and this, or else. It shouldn't be pushing mandates for vaccines that have been like the COVID vaccines that were tested for a relatively short period of time. I took the COVID vaccine myself, but I think that the mandates that many scientists push have led to the lack of confidence that so many of the public has in science. If science is a force for freedom and for knowledge, it will have universal support. That's what the role of science is.
Very well put. You were demonized for co-authoring the Great Barrington Declaration in October of 2020. Dr. Fauci called it total nonsense. Rochelle Walensky called it wrong and unsafe. Your opponents who wrote the John Snow Memorandum said it could harm 500,000 people. Reading what you wrote in the Declaration, you were undeniably right about all of it. You wrote, quote, current lockdown policies are producing devastating effects on short and long-term public health. Doctor, what does the public health data tell us today in the aftermath of COVID-19 and in 2023 and 2024? What does that data tell us today?
Well, Senator, first, millions of children were out of school for years. The rates of suicidality and depression are through the roof. Learning loss will have consequences throughout their entire life. There were people who skipped their cancer screening, who have late-stage cancer now that should have been picked up earlier. There's the trillions of dollars we spent that actually caused the inflation that we still suffer from. The UN, early in the pandemic, estimated that almost 100 million people would face starvation as a consequence of the economic dislocation caused by the lockdowns. This is devastating. This is devastating policy that didn't need to happen. The Swedish example, for instance, where there's lower death rates, all-cause excess death rates in Sweden relative to their neighbors, including Norway, including Germany, which locked down more, is an example that we didn't need to do the lockdowns. Florida having lower all-cause excess death rates than California, again, is an example where the lockdowns did not save lives, but had tremendous consequences on the well-being of the poor, the working class, on children, and the vulnerable.
Yeah, I want to read a little bit more. You said in the declaration that, quote, keeping students out of school is a grave injustice. Now today we see student achievement and grades well below the pre-pandemic levels. You also wrote that, quote, young, low-risk adults should work normally rather than from home. Restaurants and other businesses should be open. Arts, music, sports, and other cultural activities should resume, end quote. Now we see many communities and cities are unsafe today and have been dramatically changed because of the lockdowns during COVID. In a nutshell, Doctor, what would you have done? What would you do differently now than what these obviously ill-advised leaders at NIH and otherwise and other places do? How would you have done it differently in a nutshell?
Well, I still would have opposed the lockdowns, but if I'm confirmed as an NIH director, the kind of thing I would have done is I would have allowed there to be scientific debate and discussion. There's tremendous uncertainty what to do during pandemic.
Thank you. I yield back.
We need debate.
Thank you. Dr. Senator Blunt Rochester.
I'm promoted. Thank you, Chairman Cassidy, and thank you, Dr. Bhattacharya, for meeting with me ahead of time, as well as your testimony today. I want to echo some of the concerns that my colleagues shared about the risk to the entire NIH research enterprise. One, the concern about the reported 1,200 individuals who were fired, including scientists, hundreds of scientists. We talked about the concern for being able to recruit even and retain this kind of talent. Two, the blanket and illegal 15% cap on indirect costs on our research institutions. Even in a bipartisan way, there was concern about that in this hearing. The funding and communication freezes, cuts in programs for training for future generations of scientists, and the fear that supporting diverse clinical trials will no longer be a priority cause serious concern and alarm. And to understand that, I think you can look no further than the issue of Alzheimer's disease and dementia. As we all know, Alzheimer's is a debilitating and costly disease afflicting nearly 7 million Americans and costing $360 billion in 2024. But this doesn't even include the cost of care that's provided by 11 million individuals. And it really doesn't even touch the toll that it takes on the individual and their families. I don't think there's anybody who hasn't been impacted by it, whether it's even my mother and my grandmother. Some of the most important work that NIH has been doing is on the disparities in cognitive aging. Do you think the administration's executive orders and terminations of aging research projects is harmful or helpful to improving our understanding of Alzheimer's?
Well, Senator, first I should say I am fully committed, and as is this administration, I believe, to making sure that all the health needs of every American is addressed, no matter what their race, color, sex. The goal of the NIH, the mission of the NIH is to meet those. So, for instance, the representation of minorities in trials are, as you mentioned, is something that I'm fully committed to, and I see nothing in the President's executive orders to contradict that. In fact, quite the opposite.
I think the challenge is they're vague, and people are questioning, what do they mean? What are the impacts? Even the fact that these programs that have been canceled or delayed include the Maximizing Access to Research Careers Program, training grants to support pre- and postdoctoral scholars, the NIH Intramural Program, the 2025 NIH Summer Internship Program, the Advancing Diversity in Aging Research Program, and then the firing of 10% of the staff at the Centers for Alzheimer's and Related Dementias. That's what causes the concern, because we're thinking about the pipeline of those individuals that are going to work in this area. So can you help me to just understand how getting rid of these programs is going to improve our understanding of Alzheimer's prevention and treatment? And what safeguards would you put in place to ensure that these changes don't lead to poorer health outcomes, by any gender, race, disability, ethnic group, or other vulnerable communities?
Well, Senator, first, as you know, I wasn't involved in any decision-making at the NIH during the, up to this point. If I'm confirmed, I will look to make sure that those programs and other programs, if they're appropriate, will continue. I want to make sure that every single scientist at the NIH that's doing this kind of life-saving work, including on Alzheimer's disease, especially maybe in Alzheimer's disease, and also scientists supported by NIH-funded research have the resources they need. I'm committed to making sure that the NIH funds are spent to address America's chronic health needs.
The reality is that we know that individuals with Down syndrome have a staggering 90% chance of acquiring Alzheimer's in their lifetime. Black and Hispanic individuals are more likely to develop Alzheimer's. In a lifetime, women are twice as likely as men. And so I have some questions that I will potentially have to submit for the record, but will you commit to ensuring that researchers specifically studying health disparities and working to increase clinical trial diversity will not be targeted or penalized based on their work?
Senator, I commit to making sure that researchers that are addressing the health needs of minority populations and basically every American will have the support they need.
A lot of folks are using code words and selecting out, whether it's in a grant, they're doing targeting, sweeps, word searches. Will you also commit that you will not do that as well?
Senator, I guess I'm not sure what you mean by targeting code words, but I'll say that I believe very strong. I committed my life to addressing the health needs of vulnerable people, including minority populations. I'm absolutely committed to that. That NIH continues to do research to address those health needs.
My time is expired, Mr. Chairman. Thank you, and we want to make sure that we work with you.
I would look forward to that, Senator.
That these executive orders don't have the adverse impact that we are already seeing. Thank you. I yield back.
Thank you, Senator Blunt-Rochester. Senator Hawley.
Thank you, Mr. Chairman. Dr. Bhattacharya, congratulations on your nomination. Thank you for being here. I enjoyed getting to visit with you the other day. Let me just start with the subject that you and I visited about and that I also asked your soon-to-be boss, Robert Kennedy Jr., about when he was sitting right where you are, and that's the use of abortive fetal tissue in NIH-funded research. I asked now Secretary Kennedy directly if he would reinstate President Trump's policy that prohibits abortive fetal tissue research in NIH-funded grants. He said that he would. Let me just ask you the same to make sure we're all on the same page here. Do you support that policy? Will you prohibit the use of abortive fetal tissue in NIH research, NIH-funded research?
Senator, I'll absolutely follow the lead of Secretary Kennedy and President Trump on this. Just very quickly, may say why it's so important that we have alternatives. Because during the pandemic, I would often be on Catholic radio, and people would ask me whether the mRNA vaccines were made or developed with fetal stem cell lines. And I had to say yes, and they had a lot of the folks who were calling in had ethical objections. In public health, we need to make sure the products of the science are ethically acceptable to everybody. And so having alternatives that are not ethically conflicted to fetal stem cell lines is not just an ethical issue, but it's a public health issue. We need to make sure that everyone is willing to take the kinds of progress that we make, and so I'm absolutely committed to that.
Very good. Thank you very much. And I think it's a tremendous point that it is not only an issue of moral principle, although it is an extremely important issue of moral principle in the first instance, but it is also a public health issue. We think about millions and millions of Americans who are understandably very concerned about the components, if you will, of many of these palliatives and vaccines, and we want them to be able to access this on the same basis as others. So thank you for making that point. Let me ask you about something else that your soon-to-be boss, Secretary Kennedy, has said recently, that he has talked about his concerns that NIH is working to advance, in some instances, Big Pharma's bottom line rather than the health needs and health interests of the American people. And he recently wrote in the Wall Street Journal that he wants to propose stopping NIH funding going from researchers who have conflicts of interest, who have a financial benefit with a Big Pharma company. Can you comment on that? Do you support that effort? And can you comment on the importance of making sure that what we're doing with our NIH funding is prioritizing the health of Americans, not the profit of any particular corporation.
Senator, I think that transparency in conflicts of interest is fundamental to trust in science, and I absolutely committed to making sure that transparency is at the center of the work supported by the NIH. I also commit, Senator, to, and I mentioned this earlier, to supporting research on products that are already off patent, that don't necessarily have a drug company behind it, but that could have potentially enormous benefit for treating chronic diseases or preventing chronic diseases. I think the NIH ought to be doing research in support of the public good, not just parochial research in support of a few companies.
Fantastic. I think that's so important to restoring the sense of credibility and trust that the American people frankly have lost in the NIH and much of our public scientific apparatus because of the financial conflicts of interest, because of the prevalence of big pharma, but also because, and you and I discussed this as well, what happened during COVID-19. And I just want to ask you about that in my remaining moments here. I had the opportunity to question the author, or one of the co-authors of the now infamous Proximal Origin paper. Dr. Robert Gary is the individual who I had the opportunity to question. He wrote that paper on March 17th, 2020. You probably remember, Doctor, this is the paper that infamously stated, and I'm going to quote it now, that the SARS-CoV-2 is not a laboratory construct or a manipulated virus. Under questioning by me, Dr. Gary admitted he actually had no knowledge of that at the time. He wrote that in March of 2020. He had no evidence to suggest that was the case. This was, in fact, a piece of purist propaganda. He has since had many of his research products withdrawn from peer-reviewed journals because he hasn't followed appropriate peer-reviewed standards. This effort, this propaganda effort, and that paper, as you remember, was used as the basis of government-directed censorship to those in the scientific community, like yourself, to millions of ordinary Americans. The net effect of this was a tremendous loss in confidence by the American people in the NIH and in our public health officials. You and I have discussed the vital importance of restoring some of that credibility. Talk to us about how you see going about doing that.
Senator, that episode is a low point in the history of science. The top officials of the NIH abused their position to hide support for research that may have caused the pandemic. And I commit to making sure that all of the activities of the NIH, not just backwards, but going forward, are transparent and open to the American people and to Congress. That's vitally important for the future of the NIH and for the future of science itself.
Thank you, Senator Hawley. And now, Senator Brooks.
Thank you so much, Mr. Chair. Good morning, Dr. Bhattacharya. I know you've had great experience at NIH, and so it goes without saying that NIH is a crown jewel, not only in the state of Maryland, which happens to be my state, but it's a crown jewel for our country, where we have many, many talented scientists and researchers who are there. That brings me to a quick line of questioning I have. I want to sound the alarm that some very dangerous things are happening to scientists and researchers at NIH right now. And I want to ask you whether you believe that it is appropriate, and you mentioned a moment ago about a concept around knowledge and freedom for scientists, and whether you believe it is appropriate under any circumstance to retaliate against scientists or medical researchers based on the research they have done. Do you believe that?
No, Senator, I've been subject to that myself. I know what it's like to be subject to devastating takedowns by top officials at the NIH specifically, and I will never do that. I absolutely commit to making sure that scientists are treated respectfully, especially those that disagree with me.
Now, you've even said that you believe, and you've spoken out against a culture of conformity in science and have criticized institutions that you allege destroy the reputations of scientists who do not conform with their viewpoint. I believe that is what is happening right now at NIH. In fact, your soon-to-be boss, Mr. Kennedy, when I questioned him about whether or not he would supplement his judgment for that of scientists, he said he intended to replace bad scientists with good scientists. Is this your viewpoint as well?
Well, Senator, I think that science is. I don't know what the nature of that conversation, but I think that the way that you decide what is good and bad science is by conversation, by data, by replication. I'm absolutely committed to making sure that those processes are in place at the NIH.
Okay, and you agree that we should never retaliate or even fire a scientist because of his or her peer-reviewed work that they publish?
Senator, I think retaliation and conflict that characterize the kind of discussions that we had among scientists, that comes from the top of the scientific institutions, and I commit to making sure. In fact, it's one of the 5 points I emphasized in my opening statement, that we have allow a culture of dissent and respectful conversation about scientific matters rooted in data at the NIH.
Okay, I just want to ask you about one other area of concern. It is no secret that this administration feels absolutely triggered by any mention of equality, any mention of inclusion, and the president himself, in his own words last night, essentially said America intends to erase any reference whatsoever to race or gender. Having said that, I'd like to refer to a study that you co-authored called Persistent Racial Disparities in Survival Following Heart Transplantation, and to ask you whether or not, because I understand there are some watch lists that have been created, whether you believe that on the basis of this study, should that work be placed on a DEI watch list because it references racial disparities?
Senator, I'm not aware of any watch lists. I don't intend to implement any watch lists. I will say this, that the health needs of the minority populations in this country are a vital priority for me. In fact, the health needs of every single American are a vital priority for me. I want to make sure that the research that the NIH does addresses those health needs. And I don't see anything in the President's orders that contradict that. In fact, quite the contrary. What I've heard from the Secretary and from the President is let's make America healthy, meaning all Americans.
Yeah, I know. I don't want to be naive, though. He did mention that he is absolutely triggered by anything that mentions equality or inclusion or any reference to race or gender. And so the center that you co-direct, the Center for Advancing Socio-Demographic and Economic Study of Alzheimer's Disease and Related Dementias, mentions that your mission is to diversify the set of researchers who are working in the field. And I want to know whether or not, based on that, and that it also mentions mentoring diverse scholars, which I think is a reference to race and to gender and to people with different backgrounds. And so whether you believe that this project, which received, by the way, $872 million in taxpayer dollars, $800 million in taxpayer
dollars.
Not
that much, but
that's right. Yeah,
it was less than that. But yeah.
Well, was this a radical and wasteful use of government spending on the basis of it doing this?
Senator, I'm proud of that project.
Yeah, I work.
Senator, first, I'm proud of that project. It's addressing Alzheimer's disease, and I'd say further that the idea that diverse scientists, I think what that means is scientists with diverse ideas about scientific topics. I think fundamentally what matters is, does a scientist have an idea that advances the scientific field they're in? Do they have an idea that ends up addressing the health needs of Americans? That's the key thing. And to me, that diverse set of ideas, allowing there to be a diverse set of ideas, people who disagree with each other, is fundamental to advance in science. I think free speech, and I think we...
That includes racial disparities. That's the work you've done, right?
Well, racial disparities are important to identify, but more important is to address the health needs of every American, no matter whether they're minorities or not.
Thank you so much. I yield.
Thank you, Dr. Alison Brooks. Very good sneaking that last comment in. You know what I'm saying? After the buzzer. Senator Husted.
Thank you, Chairman Cassidy, Dr. Bhattacharya. Thanks for being here. Although, as someone who grew up watching professional basketball in the 70s and 80s, calling you Dr. J is a fun thing too.
It's a real thrill for me whenever I hear that.
Thanks for your nomination, frankly, at this time in America is a victory for the scientific method. I know that you have been courageous in offering divergent views and backing them up and encouraging people to think differently about how we solve complex problems. That's what science is supposed to be about, so thank you for being a champion of that during difficult circumstances. I want to just talk briefly about something we talked about, is that we heard a lot of talk about inflation in America, but in this century, the number one inflationary cost that affects Americans, American business, the quality of life, has been healthcare inflation. And the idea that we can think differently about how we address healthy living, our diets, how we improve the quality of life, drive down costs, and improve outcomes is something I think is sorely missing today in the conversation about healthcare, and thinking differently about it is critical to doing that. So just give some thoughts about how you think your role as a director could help advance that conversation.
Senator, I really enjoyed our conversation that we had in your office about exactly this. The chronic disease problem, let's just take obesity. It seems almost intractable. For decades, we've had body weight go up, diabetes rates, chronic disease. And in a way, that's an indictment on how the NIH has functioned. The goal of the NIH is to make Americans healthy. It's to have the research that makes Americans healthy. I think I want to make sure that we allow a broadest set of ideas as possible to address this problem, because the set of ideas we've had so far have not actually addressed the problem. It's continued to get worse. Fundamentally, to me, and this is an element of faith, I guess, I believe that if we allow science to have lots of different ideas, that we will be able to meet the health needs of the American people. But if we say, okay, only a few scientists with their ideas are allowed to have support, with a narrow, like one school of thought, we're not going to make any progress. I don't have the answer to how to solve the obesity crisis. If I did, I would have already would have published it. But I want to make sure that the scientists that's out there has support from the NIH, even if their ideas can contradict what the top scientists of the NIH currently think.
Well, I spoke with Secretary Kennedy, and I know that this goes across agencies from the Department of Agriculture to Health, Human Services, but it is a tremendous cost to the American taxpayer, to the quality of life, to American competitiveness, all of those issues, sustainability of our federal budget. So I just encourage creative thinking and collaboration on that issue. I want to mention lots of conversation these days on NIH grants and talking about containing costs of how we do scientific research, but make sure that we're putting more lead on the target of that research rather than administrative costs. I know that in Ohio we have a number of entities, our universities, Cleveland Clinic, our hospitals, so forth, that are involved in this. I really believe that there are many institutions who are willing to work with you in sharpening their pencils, getting better, forcing change in how these grants are used, distributed, and focused on the research that needs to be done. And just give some thoughts, if you would, about how we can advance those conversations on this topic.
Well, Senator, I think the universities that are partners of the NIH, not opponents. I do think that there's a lot of distrust now coming out of the pandemic of the scientific enterprise and of universities also. The way to address the distrust is transparency, and I'm absolutely committed to working with you and with others to make sure that we can restore that trust by establishing transparency. Where did the administrative costs go? That's a question that could be answered with audits, for instance, and establishing the right rates. That's going to, if I'm confirmed, that's something I'll look very carefully into. I think I want to make sure that every single dollar the American taxpayer entrusts the NIH to goes to addressing the needs, the research that will address the health needs of the American people.
Great. Thank you. Thank you, Mr. Chairman.
Thank you, Senator Husted. Now, Senator Markey.
Thank you, Mr. Chairman. Doctor, I've been hearing from researchers in Massachusetts and across the country about actions taken by Trump and Musk that are slowing down research into Alzheimer's, stroke, cancer, and our mental health crisis. One PhD researcher who is working on finding better treatments for depression to prevent suicide said hiring and funding freezes have, quote, stalled their research and will stall the development of safer therapies for depression by years. A Massachusetts doctor and mentor for biomedical researchers says that Trump's executive orders and Musk's Doge minions are leading us to face, quote, an enormous brain drain, as there is little confidence that these institutions will be able to function normally. This doctor is thinking about leaving the country, which would mean the United States cedes ground in the fight to lead the world in biomedical innovation. A cancer researcher at the University of Massachusetts said the Trump administration's cuts to NIH will, quote, send progress in curing human disease down the drain. A professor of medicine and science working on improving care for Americans with dementia had their grant review meeting with NIH abruptly canceled without any plans to reschedule because of this administration's funding freezes. This will delay research by several months at least, and inconsistent funding will mean layoffs and disruption to services that improve care at nursing homes. And just this week, I received copies of letters sent to researchers who received funding from the NIH to study Alzheimer's disease and improving support for caregivers and to study how to improve mental health care in primary care settings. The letters terminated funding for these studies, stating, quote, the premise of the grant is incompatible with NIH priorities because the study explicitly included LGBTQ people. And without this funding, grant recipients will now be forced to stop research to address the mental health crisis and Alzheimer's disease. People who have committed their lives, doctor, to these efforts will lose their jobs. By unanimous consent, I submit these letters for the record, Mr. Chairman.
Without objection.
Doctor, in your testimony, you stated that you want to encourage free speech and dissent among scientists. In the spirit of free speech and dissent, will you commit here today to object to any decision made by Donald Trump, Elon Musk, or Robert F. Kennedy that would slow or stop life-saving research?
Senator, I'm not involved in the decisions of the NIH up to now. If I'm confirmed, my commitment is to make sure that all the scientists at the NIH and all the scientists that receive funding from the NIH have the resources they need to do their life-saving research.
Will you object if it slows or stops life-saving research?
Senator, my interactions with Secretary Kennedy and President Trump to date suggest that they don't want to slow research. They want to speed it up.
So will you object if that becomes evident that they're slowing the research?
Senator, I have to say I don't believe that they are ever going to ask me to do that. I think they're committed to innovation and research.
Will you commit here today to reinstating funding for scientists whose funding has been terminated because their research does not align with MAGA ideology?
Senator, I don't believe that ideology ought to determine whether one gets research or not. I believe very fundamentally in wide diversity of
funding research on the mental health conditions of the LGBTQ community, that should not be a basis for canceling funding for research. Is that what you're saying?
Senator, I'd have to look. If I'm confirmed, I'll absolutely will go look at the letters are submitted for the record, so I can go look. But if confirmed, I'll go look carefully into that. I want to make sure that the processes that the NIH has to
I appreciate
identify
that. On its face, of course, that is absurd, because they have mental health issues as well. So will you commit here today to do everything in your power to stand up for the American people and life-saving biomedical research in the face of the Trump attacks on scientific freedom?
Senator, I think I absolutely commit to focusing and supporting the research that advances the health of the American people. I don't agree with you, Senator, that the President Trump is opposed to that. In fact, quite the opposite. He is quite in favor of making America healthy, and fundamentally, the research that we do at the NIH will be
I'm being told by the researchers in Boston that they can't even hire their new trainees because the trainees who are brilliant aren't certain there's going to be a career because there won't be funding. So it's just the opposite. Trump is actually freezing, scaring, frightening the whole next generation of scientists who believe the funding won't be there for them. That's the problem that we're going to be confronting. Thank you, Mr. Chairman.
Thank you. Just a follow-up and then a closing statement. Again, thank you for being here. You said something I'm trying to square. First, in context, we know that only about 1/5 of NIH applications are funded, and you have spoken about improving that, particularly for younger investigators, which, by the way, I think your plan, just on the face of it, looks fantastic. So thank you for thinking creatively about that. And you've also, I think, correctly said we need to be putting more money into cutting-edge research, which may fail. It's cutting edge, right? But what's the alternative? But what I don't, so what I'm trying to square with that is the extra dollars for validation with all the kind of caveats you put. You'd have to have the full cooperation of the person who studies being validated, and you'd have to have the same circumstances and the same genetic makeup and the same this and that and that and this. So it seems like the validation push would put more pressure on both the cutting edge research priority and the young investigators find it easier to get money. So knowing that you've thought about that, how do you think about that?
Senator, I think of that validation work as central to doing good science. Like any portfolio that doesn't have that kind of validation built into it is not going to be reliable. So even if you do cutting edge research and it's not validated, you're not going to get advances.
So what is the difference between doing the validation research and kind of what you have criticized, that we sometimes do the same thing over and over again?
Well, the difference is that validation research is focused on the particular results that a scientist may have. I publish a study and you check my result. You get the same result as me. Incremental science is you propose a study that is like epsilon away from what already is known, and you do that.
Now, inherently, if epsilon away fails, it calls into question the original premise, correct?
Right, but it's much easier to be certain that about research that's epsilon away from the frontier to work versus like big ideas in different directions that might make big advances. Any research portfolio has to have lots of different approaches to this. I think the key to me is making sure that if early career researchers, researchers with non-traditional ideas about hypotheses, for instance, like with the example of Alzheimer's we already talked about, those get support that are in the portfolio. Some of those won't fail, and some of those will succeed. And the ones that succeed can make big advances. I don't think that the validation is just a check. Is the research that I did, do you find the same thing? That tends not to get support in the scientific community. And I think that's a mistake. The scientific community ought to support that. The NIH ought to support that. That way, the entire research portfolio as a whole becomes more reliable because we know that it's been validated by independent teams.
I don't object to the validation research. It does seem that's going to be a tension, so I look forward to you resolving that.
Senator, I look forward to working with you on this.
That'll be great. Let me just then conclude. The issue of autism just is one of those things that we all think about. I want to note that last year Congress reauthorized the Autism Cares Act, and Senator Collins and the HELP Committee were those that did that, and the law coordinates the federal autism research and is implemented by NIH. And so I look forward to working with you on that. But one thing that continues to concern me as I've listened to this conversation, there's an opportunity cost. If we continue to plow the barren ground of something which has already been validated multiple times, that there is not a connection between vaccination and autism, we don't have the money to go after the real thing. And you said something which just bing, 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 I just thought was so good, that you have a faith that a well-done research that provides answers will be convincing to people. Well, we've already had that for the vaccination. What we need is the well-done research finding the true reason for autism, and that's what the hope is for the people with autism. And if we're pissing away money over here, that's that less money that we have to actually go after the true reason. You're an economist as well as an MD. You know this. And so I look forward to, the opportunity cost of wasting money on one more thing that's been proven exhaustively, denying the opportunity to find the real reason would be a tragedy for everyone who has to deal with autism, which is all of us.
Senator, I share that passion that you have for finding the cause of the increase. That's where the vast majority of effort ought to go. We want answers. Parents want answers. Kids are suffering, and the NIH ought to be doing the research that provides those answers. That's the most important thing.
Yes. Well, thank you again for being here. I admire your sons for being so well behaved. I'm sure the presence of their mother right next to them had some influence over that. This concludes our hearing. For any senators who wish to ask additional questions, questions for the record will be due tomorrow at 5 p.m. We're through.